In this question, you have to identify the technique by which embryos are transferred to assist those females who cannot conceive. Option A, ICSI and ZIFT. Now, intracytoplasmic sperm injection, that is ICSI, involves directly injecting sperm into an egg, and it is used for fertilization but not transferring embryos to females who cannot conceive. And zygote intrafallopian transfer, that is ZIFT, involves transferring a zygote into the fallopian tube, which can assist in conception. So it is incorrect because ICSI is not an embryo transfer technique. Option B, GIFT and ICSI. Now, gamete intrafallopian transfer, that is GIFT, involves the transferring of gametes into the fallopian tube but not the embryos. And as already stated, ICSI is not an embryo transfer technique, hence it is incorrect. Option C, ZIFT and IUT. ZIFT involves the transferring of the zygote, that is an early stage embryo, into the fallopian tube, and IUT, that is intrauterine transfer, involves placing an embryo directly into the uterus. So both the techniques are used to assist females who cannot conceive naturally. Hence this is the correct option. Option D, GIFT and ZIFT. Now GIFT, as already mentioned, is not an embryo transfer technique, though ZIFT is. Hence it is also incorrect.